All right, we are on, and it is May 27th, which means that this is the 27th interview I've done, and we are 27 days into the mouth breathing awareness campaign. And I started this campaign to try to bring awareness to not just mouth breathing, but all myofunctional symptoms and the bigger picture problems that come from mouth breathing. Because really, mouth breathing is such a simple seeming thing, but it's a big red flag for other underlying issues and potentially bigger problems that could be connected to the mouth breathing. So today I have Shannon Moczygemba here today, and I'm super excited because you're a Mile Mentor grad and you also run a pretty cool Facebook group, Facebook page called OMT for the RDH. So I'm excited because hopefully this will get shared on there, or I'll share it on there. But why don't you start off, introduce yourself, and then let's just get into the story that you want to share for mouth breathing awareness.
Okay. Hi, I'm Shannon. And let me see. I started to. Well, I have my Facebook, I guess, page. Besides the OMT for the RDH, I haven't really set up a business yet. But it's called Myofunctional Harmony.
Yeah, you're getting there.
So I guess, like, where did it all start?
Yeah, because I mean, you originally reached out to me because of your daughter, right?
Yes, and so I mean, I knew that she was a mouth breather for a really long time before finding out about myofunctional therapy. Um, I would say about 4 or 5 years. But I knew it wasn't normal, but I didn't really, I guess, think about how the mouth breathing was going to affect her, like, development, like her overall
Yeah.
facial development. Um, and I started to look into things when she was about 7, and right now she's 9.
Yeah.
And I took her to 2 ENTs, and they both just kind of dismissed the issue. They didn't really think, well, that's not a big deal. And of course I thought, yes, it is.
Yeah.
And then
Like, that's not right.
yeah. So I started, I explained to both of them, like, mouth breathing is not normal. There's got to be a reason. And they just kind of looked at me like I was this crazy person. So I was like, okay, let me do some more digging. So I think it was in a really big hygiene group. And I started seeing posts, and somebody talked about grinding, and they're like, that's considered an airway issue now. And then I was like, what?
Ah,
And then
okay.
I was like, well, I grind. And so I was like, So then I think in that same thread, they talked about, of course, checking into airway. And then I think I typed in, like, airway and grinding. And then something else. And then myofunctional therapy popped up. And then your videos from YouTube popped up. So I was like, hey, let me message this girl, and then that's when you were like, oh, I have, like, the Myo Mentor program, and I was like, oh, okay, and you're like, it's for RDHs, and I'm like, oh, great, I'm an RDH, yay.
Well, I
So
think typically if you're a dentist or hygienist or speech pathologist and you reach out to me as like, oh, my kid has these issues, I'll typically say, have you considered getting training yourself? Because I always feel like the money that you're going to spend on treatment
yes, that's
is
what, yeah.
you might as well put into training if you care. I mean, if you're like into it, which you seemed like it. So
Mhm.
um yeah, so it's probably what I ended up saying, like, oh, you should get training. So
Yes, because you're like, if it's, yes, you mentioned, like, the cost of the program, and then you're like, how much it would be to do the therapy with you or one of your what do we
the
the
associates,
helpers? Yes.
yeah,
And so I was like,
helpers.
well, it seems like the smarter thing to be would, be to take your course. And then it just opened up, you know, this huge, well, I wouldn't say a can of worms. That's not, like, really the right term.
But kind
But
of like
it
Pandora's
did,
box.
yeah, like Pandora's box. And then, just all these things started coming into place. Like, because she's basically the poster child of someone with sleep disordered breathing who is a mouth breather. So she has every single symptom, listed on the possibility of symptoms.
Yeah,
Like
and
it's,
list what some of those are, because I know there might be some parents who watch this video and they're like, what does she mean, poster child? So kind of go down the list of everything that your daughter has had, and that's also on that list.
okay. So let's see, I noticed the mouth breathing. She was about 2.5. And then I think even before then, she was already presenting with the symptoms of like just not being able to sleep. So we always made sure that she was on a schedule, but she was always still very tired.
Mm,
She moved around constantly. Um, she, like toss and turn, and then she would have night terrors. So if we
oh,
didn't strictly follow, her routine, like if it just was off by just an hour or 2 hours, it would exacerbate the night terrors. And so she would wake up screaming like several times a night. And
oh,
of course, we, talked about it with the pediatrician, and the pediatrician, she kind of knew that it was related to lack of sleep, but she didn't mention anything about, well, it's, maybe it's a symptom of, she's getting poor sleep.
yeah,
So she does that. Wetting the bed, is another one. Um,
yeah. Which
and
I
then,
think a lot of parents just think, oh, it's just a phase. But, if it happens once, that's one thing. But if it's happening a lot and, it seems like, well, you're past potty training age, it can be a sign of sleep disorder breathing in kids.
yeah, and then she always has like the venous pooling under her eyes. Like they're very dark, so they a lot of the time, like I would hear the term allergic shiners.
Yeah.
She, I mean, I wasn't that parent that, oh, she can just breathe with her mouth. So, like letting her walk around with a stuffy nose or something like that. I would never allow her, to just be walking around with a stuffed nose. So she, during the day, she would be okay. I didn't notice that she would just have an open mouth posture during the day. And it was just at night, and then progressively, it just kind of got worse and worse. So when I noticed her mouth open at night, it was just barely open. And then, of course, as the years went by, it was open even more, and it would open more and more. And then, of course,
Yeah.
I attribute that to, of course, her facial changes. So
Yeah.
I remember
Yeah, because I
taking,
know I remember that was a concern you had. You're like, I feel like her face is changing, her palate is changing. And I remember you saying that
yeah,
from like years ago when we first
yeah,
met.
super high palate. I think she's been in, like, she's had a deep bite and in class 2 occlusion since like the age of 3. And of course, when the dentist said that to me, I just thought, well, that can't be right. Like, that's not normal.
Mhm.
Like, why? There's no reason for her to be, presenting with a deep bite and a class 2 occlusion at the age of 3. And of course, the dentist was, oh, well, we'll just monitor it and keep an eye on it. But it just kept getting worse. So yeah, at the age of 7, I took her to the orthodontist. I think
I know
they
that
said,
was a journey, right? The orthodontic stuff has been probably your biggest challenge, I think, right?
yes, because they don't all understand airway. So the one that I picked kind of knows about airway, so they understand that expansion can, help it a bit by, reducing the resistance, because the palate's going to kind of come down. Because when you're a mouth breather, your palate becomes so high and vaulted, pushes up against, the nasal,
Floor of
the
the
nasal
nose.
floor, yeah, the floor of the nose. So I did take her to another dentist, head of spear education. It was Dr. Rouse, and so he did a very thorough
Awesome.
examination on her, and brought up the fact that she's got tongue tie, lip tie, cheek ties. He didn't say anything about her tonsils, so that was a big relief, because I, didn't have to worry about going and taking her to do surgery.
Yeah, and finding the
But he,
doctor who would do that and all that.
yeah, and then he did say that her septum was bent to the left, and so yeah, I mean, he, of because of your class, I already knew, like, okay, yes, it's because the palate is so high that it's pushed up against the septum. So
Yeah.
um that's So he
I'm
said,
so glad
do
that you went to go see him. Dr. Rouse, I'm always so surprised. So many people have heard about me because of him. And like
really?
I've only met him once. And so
Oh,
it's
wow.
really, yeah, it's really cool. So
That
um,
is cool.
I know. I'm like, I just actually emailed him the other day and I said, thank you. Like so many people are like, oh, I heard about you and your program and your YouTube channel and all this stuff because of a spear lecture with Dr. Rouse. And I'm like, thank you. So,
Nice. Yeah, I just I lucked out because he's not that far away from here. He's about 4 hours north of where I'm at. So that's
yeah.
too bad.
Which I think you bring up a really good point that a lot of parents might not understand is like not all orthodontists have the same education. And for you, and this might not be right for every parent, but to find the orthodontist who knew these things that you cared about and that you are trained in, you're willing to drive 4 hours, and I would be too. But some people, and I'm sure you have friends and stuff, they're like, why don't you just see the orthodontist down the street? You
Hmm.
know, so I think for a lot of parents that can be, it sounds crazy, but once you know all this stuff, it makes perfect sense. So I don't know what your thoughts are on that, but
Oh yeah, we drove um we drove 6 hours to get her tongue tie released and her lip tie,
oh man.
because she was trained but in the she had training with Dr. Zoggy, so she, and she did sutures, so I was like, oh, thank God,
Yeah,
because
because
the
sutures are good.
stretches, and I was like, no, that sounds much better to get stitches afterwards, so we don't have to worry about this,
Yeah,
anything, any
let's give that doctor a
retraction.
shout out too. What was her name?
Oh, her name is Dr. Garrett, and she's with a dentistry group called Camerata Pediatric Dentistry.
Yeah, Dr.
Um,
Rachel Garrett. She's actually in my current Mile Mentor class.
yes, she,
So
yeah, yeah, she told me. I just saw her
I
this
know.
past
So
week. I
that's
just
cool.
saw
I
her
didn't
this week.
realize.
Yeah, because she did my niece's um first phase of the release because she's tied to the tip.
Wow.
So she's gonna get a two-phase release. And they just did that on Thursday, last Thursday, almost a
Yeah.
week. Hmm.
It's hard. And I have this experience working with people all across the US because I see patients online. Trying to find the right providers is the most challenging thing. I think if you live in a small town, like I know you said you live in Mission, Texas, which is near the Rio Grande Valley, and where else did I say? McAllen. I really
Yeah,
pronounce.
so the Rio Grande Valley is like, it's big, like land wise. I think it takes about 2.5 hours to drive from one side of the valley to the other side. We're just not densely populated like Dallas or Houston.
Yeah, so you have to drive and go to like bigger cities to find these providers. And I think, like I was
Yeah,
saying earlier, some patients just don't understand why wouldn't I just see my dentist in town to do the frenectomy or the orthodontic treatment. And I wish it was that easy, you know?
yeah, it's definitely not. Yeah, because we don't, I mean, there aren't even a lot of dentists that do like phase one ortho. It's the majority is, oh, just wait until all the permanent teeth fall out and then we can just address it all at the same time.
Yeah. Which from our perspective, from the myofunctional, like guiding the growth side, it's too late, right? Because they've already lost so many
Right.
years of growth. So
Yeah, because by
yeah,
that point, the majority of the kids have already like their facial features have already, like, facial growth is already done by 12, 13.
for
And that's
sure.
usually when most kids are done, losing all their baby teeth. So to
Mm.
wait until that point, there's not really an opportunity for expansion and making room for the teeth. And we do have a lot of dentists or orthodontists and dentists that, they'll just do extractions and then put the ortho.
Yeah. Which, you only like not everyone knows all these things, and I'm hoping that at some point it becomes the mainstream. And so I'm definitely never wanting to say there's like bad orthodontists and bad dentists out there. I think it's just different philosophies. And so finding somebody with the same philosophy that you have is the point we're trying to make, and that I think is really important if you're going to go down this path. And I think knowing that ahead of time will help a lot of people. So I'm super glad this conversation came up because it hasn't come up with anyone else. So
Really?
yeah.
Oh, well, that's good.
Well, so where are you guys today? You're working with Dr. Rouse.
Um, what? Well, no, well, actually, no. He just did the consultation to tell us what to do. He actually doesn't do ortho anymore. Like he just goes and lectures on airway, and he does more prosthodontics.
Okay. Okay.
Yeah, so he used to do airway. I know he treated his son because his son was having a lot of airway issues, and so that's the reason that he decided to go down that path, because he's like, there's got to
Mm.
be something else, like there's something wrong. There's got to be something else. There's got to be a better way. Um,
Yeah.
and so that's how he went into airway.
So
But
did
now he
he,
just kind of lectures everywhere. He lectures all over the place.
did he
And
help
then
you find someone, or is he like coaching a local orthodontist, or what is your
so
daughter's treatment?
well, he recommended to do phase 1 ortho with expansion. And then of course he said do releases of all the tied frenum, and then to do myofunctional therapy to correct, all the dysfunction that she has, like her low tongue posture. She's got basically her whole face is a dysfunction because overactive, orbicularis oris, overactive mentalis.
Yeah.
So he said to do those 3 things, and then he was like, and then she'll be set, she'll be great. And
Okay. That's
so
good.
we did the phase 1. It only took 9 months. So I think we started in August. We started in April, right? I think we started in April because it was
Mm.
towards the end of school. So we did the expansion, and then they do, like the 4x4 with the molar bands. And we were done fairly quickly. It only took 9 months. They gave us an estimated time of 18 months.
Yeah.
But
That's fast then.
well, I think, I'm hoping to go back and talk with the orthodontist and say, like, is this the average time for the majority of your patients? Because I feel like the only reason it was so quick was because of the myofunctional therapy. And then I had her chewing on the myo munchie, and then I also
Oh,
had her in a myo brace, like all
wow.
night long. So, I mean,
So
I
she's
don't
like
think,
getting extra treatment.
yeah, yeah, because I was like, because I wanted to get the ortho off as soon as possible. And yeah, it only took 9 months for phase 1.
That's
Um,
awesome.
so we just need her second primary molars to fall out, and then we can start phase 2. But of course, that's another, like, I wouldn't do phase 2 with them because they don't do any functional appliances. So they
Mm.
do like an Herbst appliance, or they do a like twin block,
Okay.
and those are like, these retractive forces, and she already has so much mid-face deficiency. Like her face is so flat because she was mouth breathing for such a long time.
Yeah.
So that, yeah, we'll probably have to travel 5 hours to find. Well, actually, I found Dr. Poplin. He's in Austin, Texas.
Okay.
So he's the go-to guy in Austin for releases on people of all ages, infants to adults.
Wow. I love
He
your
knows.
dedication. It's awesome. But I mean,
So
it's hard. You can't unlearn all these things, right? Like once you know it, like you
no,
just can't be satisfied not doing the full treatment that you know about, right?
right, because yeah, so we're doing like email, and so he's also now doing orthotropics, and so I was
Okay.
like, what? So I was like, wow, he's like basically the go-to for everything,
Wow.
because
Yeah.
he works with myofunctional therapists, and then he's doing releases, and then now he added orthotropics to his list of things that he does well. Um,
Awesome.
because he's, yeah, super knowledgeable as far as releasing ties go. So he does sutures. He knows, I think he also trained with Dr. Zaghi as well.
Great. Oh, geez, that's a really good resource. So awesome. I told
Yeah.
you what happened. Like it's taken a couple years, but you're finding the people, right?
Hmm.
How does she do with actually doing the exercises with you? Has she been like a compliant patient? How's the therapy gone?
Um, it's like hit or miss.
Yeah.
So some days are good. Today was not a good day. I don't know, maybe she was just extra bored, and I don't know, she just had a really bad attitude today. She didn't want to do anything.
I think that's the challenge. I mean, with young kids and, especially when you're a mom trying to do the therapy too, that can be a challenge. I mean, sometimes it works really well, but sometimes I find myself recommending, like, if you have another friend who does myofunctional therapy, like, work on each other's
Yeah.
kids.
Yeah, that's probably a lot easier. Yeah, because she was not having it today. And
Yeah,
so her tongue is up.
good.
So I successfully completed that task, confirmed by CBCT scan. So
Good.
I was like, yes.
The lips are the final thing.
Yes, because well, yeah, like just another issue stemming from the mouth breathing for such a long time. And I mean, I guess everyone is affected differently, but
For
I would
sure.
say the mouth breathing just destroyed everything. Like it just destroyed her face because her upper lip is so short. And so that's why she has so much lip incompetence, because the lip is
Yeah.
so short. Um, and then her overactive mentalis, so her lower lip is everted. So her lips are also uneven.
Yeah.
So that's what we were focusing on today, like the exercises that will help even out her lips and
Yeah.
get her to
I mean, the
stop.
Mile Brace and Mile Munchie should be helping with that lip competency as well. But it's hard to get the lips around it. But if she can try while she has it in, that will help. It will help a lot.
Yeah, what have I tried? I tried like button pulls with
Yeah.
the munchie inside, and of course, immediately
Butt
I
pulls
can't
with
do that.
Munchie.
Yeah, and she was
Oh
like,
wow.
really do that. And so I'm like, well, you can just try it. So she tried it, and she can't really hold it very long, of course, with the munchie inside, but she can hold it just a tiny bit. So
Wow, that's a cool. That's an exercise I've never done. So that's a new invention to me.
so I was like, make them work extra because I mean, I guess too, because she's a kid and it's really hard for her to just stay with her mouth just completely shut and like
Mhm.
not talk, not say anything for just 10 minutes, you know?
Yeah.
So yeah, I don't know. It's just hard. And then I have to remind her, like, well, you have to chew it a little bit. Like, you can't just leave it in your mouth and then not do anything. You have to actually chew it a little bit, make sure your
How's she do
lips.
with the saliva? Is she better? In the beginning, that's always a big issue.
Yeah,
Drooling.
no, she's totally fine. Like she can
Good.
swallow
Okay.
with it. She doesn't drool with it. But I know, like, yeah, I know exactly what you're talking about because my son can't do it at all. He's like, I can't do it. So he pops it out, goes like
Swallows, puts it, yeah.
puts it back in. Yeah.
There's a learning curve to it.
Yeah.
Well, no, this is great. I love that you shared your story, and some really important points came up that I think will help a lot of other parents, and hopefully anyone who listens to this will be able to connect some dots on the mouth breathing, the facial development, the orthodontics, the tongue tie, all the stuff that we covered. Oh, one last thing. How's your daughter's sleep these days? Is it better?
Um,
I know
I
you said
feel I feel like it's better, but she's still, oh man, she has such a long way to go.
Mm,
Because the mouth breathing also affects, like the turbinates and then the
yeah,
adenoids. So her tonsils seem like they're okay because Dr. Rouse didn't say anything about her tonsils.
yeah.
Um, he he said that they were okay. Like he's not, well, I don't see that, you need to
Mm,
immediately go take them out because he said, try, focus on addressing her myofunctional disorders and they should they should reduce in size from like the inflammation from the mouth
yeah,
breathing.
when she can start
Uh,
nasal breathing better.
yeah, so I think also working on her breathing will help it. But yeah, in the CBCT scan, we confirmed that her turbinates are, well, one side is bigger than the other side.
Mm,
I think it's the left side that's bigger. And then the adenoids are
okay.
also enlarged. So
Yeah, so that's gonna make it tough at night. Did anyone give her like nasal sprays? Like the ENTs will often do those like prescription nasal sprays like for like 3 months to try to clear things up. Did anyone give her that?
yeah, and that's what the two ENTs had recommended.
Hmm.
Um, but I never did it because I'm like, well, her nose is never stuffy, and I don't want to just be, squirting her nose for
Yeah.
no reason. Um, so if she is stuffy, which is a couple times a year,
Hmm.
and not even like that bad,
Hmm.
then I'll do, yeah, a nasal spray.
Yeah. I mean, supposedly that stuff will help with the turbinates and the adenoids, with the overall inflammation and not just the nasal congestion. So it might be worth a try. I mean, I don't know, but yeah, usually if they say do it 3 times a day, I'll say, well, try it once a day or maybe just before bed. And you know, if you're not wanting to do the full amount, because a lot, I mean, it's a steroid nasal spray, so it's pretty
Yeah.
powerful. I know a lot of parents don't necessarily want to be doing that if they can avoid it. So you can do like a half spray once a day rather than like full sprays 3 times a day or whatever. So yeah. Well, awesome. Thank you so much. Anything else you want to say or add before we just wrap it up?
Um, I don't know. I mean, other than, you know, maybe like you're your child's, biggest advocate, and, just fight for what you think they need. Like, don't accept, oh, they're fine. You know,
Yeah, no, I know you've
don't
done that a
accept that, like,
lot.
oh, that's the answer. Oh, they're fine. They're
Yeah.
still breathing. I'm like, well, not really.
Yeah, no, I mean, me and you have talked about this a lot, not on here. You know, all the stuff you've been through, really saying like, no, my daughter needs more. She needs help. She needs this. And it has been kind of a battle for you. I mean, at least from the stories that
Yeah.
you told me previously. So I am happy that you persevered. I think that's really good advice to give parents is if you know something is wrong, like listen to that and keep pursuing. You know, if one doctor says you're fine, then find another doctor that can, you know, maybe see more of what you're looking at, right?
Yeah, definitely.
Awesome. All right. Well, thank you so much, Shannon. I'll let you go. Have a great night, and thanks again for sharing your story.
All right. Thank you so much.
Bye.
Bye.